Hi, I'm Brandy G, the community MP, named Brandy Davis. I'm a family nurse practitioner. I have been practicing in various settings for the last 14 years, and I'll be joining my colleague here today with some patient education.
And I am Brandy B.
You so goofy. She goofy. This is our first time, y'all. So
Brandy B, which stands for Burnett. But yeah, I've been an MP for almost 3 years, and all my practice has been in community health. So that's where my heart is. Probably will be where I stay.
Yes.
So, but today we have some information for you guys in regards to colon cancer, colorectal cancer, and screening, prevention, and signs and symptoms to look for.
All right, B, so let's talk.
Okay.
So the purpose of today we're going to do this video to educate our listeners on colorectal cancer and screening recommendations so that you can make an informed decision on what you want to do with your health care. This video is not going to take the place of you seeing your primary care provider, but we just want to give you some information to help you make better decisions about health care. Anything you want to add to that, B, about the purpose?
No, I think that pretty much sums it up. But yeah, definitely always go with what your primary care provider recommends for you. This is just, like she said, information to help you kind of give you a heads up on like what your primary care doctor may recommend.
Okay, so we have some disclaimers. Well, we have no disclaimers, actually. We are not being paid to do these videos at all. And what else, B?
That's pretty much it. So, yeah, so I hope you guys enjoy what we have to say. And I hope that you learn something from it.
Okay, so what is colon cancer?
So colorectal cancer is cancer of the colon or the rectum. So basically the end of the digestive tract. Basically, most people know it as stomach cancer. So that's basically what colorectal cancer is.
Okay. So we're going to be talking about the different screening tests to help prevent or to find out if you do or you don't have colon cancer. Okay. So there's several different tests. And we're going to go through, we're not going to go into detail with every test, but we're going to tell you about some of the most common tests, okay? So, of course, the colonoscopy, you know, that's like one of the gold standards. That's the one that most people get. How often do you get it?
Every 10 years if it's normal.
Okay. And some people get it like earlier, depending on...
Yeah, they're... so usually the recommendation is, you get screened at age 50, unless you have like... family history or some other risk factor that we'll discuss later. But the options for getting screened for colorectal cancer are, like Brandy said, the colonoscopy, which is every 10 years, gold standard, the number one thing. The rest of the tests, if they come back abnormal, we revert you back to getting a colonoscopy anyway. So that's why we say just go ahead and get the colonoscopy. If there's anything abnormal that, when you have the test done, they usually can detect it. And any polyps that they see or anything, they can remove them immediately. No other test you can do that.
Okay, so some of the other tests that they have available outside of the colonoscopy is the stool test for blood, the fecal stool test, which is a common one. It's a very common one when people are uninsured. Yes. It's probably one of the cheapest tests that can be given to check for colorectal cancer. But like Brandy said, with that test, it's not the gold standard. So you can miss a lot of colon cancer with that test. Okay? We also have the stool DNA test. That's something new. It's been on the commercials, the Cologuard.
Yeah.
So they're sending out a box where you can
give a stool sample.
Put a poop in the box.
That's
basically what it is. And submit it, and they'll check your stool for different markers that may be genetic for colon cancer or not.
Yeah.
Then we have the sigmoidostomy. So that's just when they just do a test on the last part of the rectum, that area. Yeah. So that one, I think it's like every 3 to 5. I think it's every 3 years. We'll definitely look into that.
Yeah.
And last, they have a CT scan, which that is probably, I haven't seen that one done.
Yeah, me either. So, I don't know if that's something new that they're offering, but again, if it comes back abnormal,
you still got to revert back to a colonoscopy. So what we're saying here is that the colonoscopy is the gold standard. Go ahead and just get your colonoscopy if you can. And if you can't, there's always other options for you.
Yeah. And so just to kind of touch on like how frequently you get each of them done. So the colonoscopy, like we said, if everything is normal, it's every 10 years. The CT scan, this is if these tests are normal. If they're not normal, you may have to get them done more frequently. Mm-hmm. It'll be dependent on what your specialist or your primary care doctor recommends. But for the CT scan, it's every 5 years. If you choose to do the stool testing, which a lot of the uninsured will choose because it's the cheapest. And most of the time, most clinics can get it done for them for free. You just have to check with your clinic and see. But that one's annually. The sigmoidoscopy is every 5 to 10 years. And then this one, the stool DNA, the poop in the box, is still under, I guess, investigation on how frequently. But right now they're saying every 3 years is what the recommendation is.
So, but just remember, if any of those tests are abnormal, mm-hmm. your primary care doctor or your specialist that you're seeing can actually have you get the test even earlier, every year, every 3 years. Right. So just remember that. Okay. All right. So who should get screened? So guidelines states that age 50 to 75 should be the ones to get screened. Okay. People who are at increased risk are if you have a family history of colon cancer, if people who have a disease of the colon, you may have Crohn's disease, ulcerative colitis. These are some diseases of the colon, so they should get screened also. Cystic fibrosis, history of any type of stomach or pelvic radiation. Let's see. If you have a family history of hereditary colorectal cancer syndrome, and African Americans. Okay, let's talk about African Americans. Yeah. So why, B?
So research doesn't really know why, but we know that African Americans are at the highest risk. They lead by like 20%.
That's high.
Yeah. So 20% greater chance of mortality than the white people or any other race. So yeah, that's why we recommend, you go to the doctor, you get your screenings done, especially if you're African American or if you have any of the other risks that we discussed. Okay. So the for African Americans though, they are starting to push back the age limit from 50 to 45. The American College of Gastroenterology and American Society of Gastrointestinal Endoscopy are already recommending that African Americans start to get tested at age 45.
Oh, so it's almost time for me to get tested in a couple of years.
Don't talk about it. Don't talk about it.
Yes.
I ain't going to tell you how many years I got left. But
so let's see. Some other risk factors that you may want to consider. Let's see for early screening. Race, as we said, African Americans, gender. Men are most likely than women. Okay, so, all right, the mortality rate is 25% higher in men than in women. Wow. History of renal transplant. And let's see, congenital diseases may also put you at risk to get screened earlier. Okay?
Yeah, so if you have diseases that you were born with and you just want to talk to your primary care provider and find out if that puts you at an increased risk. So always just be like, very thorough whenever you're going through your history, your medical history, your family history with your primary care provider or any provider that you see, so that, if anything pops up, they know, oh, this person's at increased risk. Let's get them tested sooner. And not just with, colon cancer, but with anything really.
And we'll be talking about different cancers and different screenings throughout this process, this journey that we're starting today.
Yeah. Okay. So we're excited. We hope you guys are excited. Some risk factors that don't really alter test recommendations at this time, but are under research. And there's been some studies that show that they may contribute to like putting you at increased risk of having colorectal cancer. Obesity, diabetes, consumption of red and processed meats, tobacco use, alcohol, and one of the other things that they're researching right now is if you've had your gallbladder removed, they've had studies show that puts you at increased risk of having colorectal cancer. But let's talk about obesity and diabetes, because we know that runs in the African American community.
Yes. So what you're telling me, B, is sounds like that we need to work out more.
We need to work out.
We need to get our BMIs down. We need to really start watching what we eat, especially the red meat, the processed foods.
Yes.
So what should we be eating? Green leafy vegetables?
Yeah.
Okay.
Yeah, green leafy vegetables.
Okay.
Lean meats like chicken, turkey, fish. You know, y'all like fish in New Orleans.
So I'm thinking that helps you digest your food a little better. Yeah. It's probably the digestive system is helped with eating those foods instead of eating processed foods and red meats. Okay.
And red meats are actually linked to several types of cancer. So
but the steaks are so good.
I can't relate. I can't relate.
Okay.
But yeah, so obesity and diabetes kind of go hand in hand. So like B said, exercising and monitoring what you eat. Of course, if you smoke, just quit. Find something to replace the habit with, because the tobacco use, it just can cause so many problems other than just, of course, colon cancer.
I just saw alcohol. I didn't realize alcohol was there.
Yes.
Okay.
Alcohol.
Okay.
Our friend alcohol.
So, moderation.
Yeah.
So, okay.
And even like with red meats and stuff, eat it if you just gotta have it, then eat it in moderation. Don't eat it every day.
We know who doesn't eat meat, y'all.
So it's probably easier for me to say don't eat the meat because I don't eat meat. But you can cut back. Everybody can cut back. You'll be fine.
I totally agree.
Yeah.
It's for your health. I totally agree. That's something that we should do. Okay.
Let's see. So as we talked about, African Americans being diagnosed with colon cancer early in life, and we just had, of course, Chadwick Boseman, and he was diagnosed at age 38. I mean, that is abnormally early, but we teach you the signs and symptoms to look for, which we're going to discuss. And he ended up dying at 42?
So, really young. So I did see some research probably like a couple of weeks ago that they're starting to see colon cancer in younger people, even before age 35.
Did it say why?
I didn't go into detail. That's something I'm going to look up, but they did say that they're starting to see colon cancer in those younger than 35, and they were saying like within the next 10 years, like it's gonna go up higher. So that's something we need to be made aware of. So we're gonna start talking about some of the signs of colorectal cancer. These are just some signs. Some people may have different signs, but these are some of the ones that are known. Okay, rectal bleeding. It's often you don't have any pain. It's painless rectal bleeding. Changing your bowel habits. Maybe, all of a sudden you may start having diarrhea, or you may start having chronic constipation. You can't go. So both diarrhea and constipation, that's abnormal. Stomach pains, unexplained weight loss. These are some signs that may, should do like a red flag. You should start asking a question. When you start having those symptoms or signs, ask someone, ask your primary care doctor. This is what's happening to me. Can we check this out? Anything else you want to put with that, Ben?
I think that's pretty much it as far as the signs. But so a lot of people, will have painless rectal bleeding, and they may think, I had a baby a long time ago and I've had hemorrhoids. And they ignore the symptoms. But if you have the symptom, you get to test it. Also, sometimes the blood in your stool may not just be red. It may be old. So if you're having like dark tarry stools they just look sticky, icky, and they usually stink really bad. That can also be, a sign that you have blood in your stool and you want to go to your primary care provider. Let them know. Let them make the recommendations on what you should do next.
Okay. So how can we prevent? So one of the things that we talked about, some type of lifestyle modifications, is physical activity.
We gotta exercise.
It may help reduce our chances. We can't really say it's going to prevent, but it may help reduce our chances for being at risk for colorectal cancer. So physical activity, how often should we exercise?
Most days of the week for at least 30 minutes. And so when we say exercise, anything that gets your heart rate up and you break a sweat. So you want to do that for like 30 minutes. And I know a lot of my patients will be like, oh, Brandy, well, I work every day and I walk at work. Yeah, but when you walk at work, it's stop and go, stop and go, stop and go. So that's not really considered exercise.
So how fast are you really walking at work? Are you pumping to get your heart rate up? So if you're really not pumping,
you're not.
So let me tell you something. What I've learned, you can give yourself 30 minutes every day.
Yeah,
you're working, you're taking care of your kids, you're giving everybody all these hours in your day. Give yourself 30 minutes. If we can give ourselves 30 minutes every day, we'll do some good for ourselves.
I mean, it'll just end with you having a longer, healthier life. So keep your joints lubricated and heart pumping, and you'll live a longer, healthier life.
So I see something, a diet rich in fruits and vegetables and low in red and processed meats.
Again, we're back to this diet stuff.
I'm going to start following this. This is something I am, because colon cancer runs in my family.
Oh, does it?
My grandmother, she passed away from colon cancer.
Oh.
So my mom did get their colonoscopies, her and her brothers, at an earlier age. I think she started like at 45.
Really?
She started, and she get it like every 2 to 3 years. She's getting a colonoscopy. So I am going to change my diet. Okay. Let's see this. A daily baby aspirin or use of NSAIDs.
So that's under research too, but lots of studies have showed that the use of a daily aspirin, and it didn't really say, research hasn't really figured out why, but they have noticed that people with who consume like a baby aspirin or NSAID. NSAID is basically like ibuprofen, Motrin, Aleve, those type of medications have shown lower risk of colorectal cancer. So that, like I said, that's still under research.
So more to come. With
always talk to your healthcare provider before you start any medication, just because sometimes, even though studies have shown that the aspirin or Motrin or ibuprofen has decreased the risk of colorectal cancer, you still want to talk to your primary care provider, because maybe that's not a good medication for you for some other reason. So that's basically it for us. Most of our information we obtain from medical resources such as Up to Date and the American College of Gastroenterology. And if you have any questions, you can leave us a comment below and we will get back with you.
You guys enjoy your day.
And get screened for colorectal cancer.
Yes.